again, and congratulations on your progress. You are now about 3 weeks out from your shoulder surgery. Within the past week or so, you probably saw the real Dr. Badman, or his physician assistant. At that visit, you obtained x-rays to verify that all your components looked good and were in the correct position. The team also checked your surgical incision to make sure all was healing well and the waterproof dressing was removed. You were given a prescription to start physical therapy. If you already have a therapist that you trust and like, we would advise that you go back to that therapist. If, however, you don't have a therapy center or therapist you are familiar with, our team would usually provide some recommendations for therapists close to your house that Dr. Badman routinely uses and trusts with your care. If you have already started your therapy, that's great. But if you have not yet started, it is advised you begin as soon as possible unless otherwise directed by Dr. Badman. You were also instructed to continue to use your sling. The bumper was removed, and we now request that you continue to wear it when you are out and about, or around a large group of people, such as church or in situations where someone may easily bump into you. We request that you do this for at least 1 to 2 more weeks to be safe. If you are at home in a controlled setting, such as sitting on the couch, it is perfectly okay to remove the sling and rest your arm on some pillows. Dr. Badman, finally, will also still advise that you sleep in your sling to avoid rolling on it and awakening in an awkward position to avoid unnecessary pain. In terms of now returning to your regular bed, this is definitely the time you can try. You will not hurt the shoulder by laying on that side, but patients typically state that it can still be uncomfortable to lay on it. In regards to driving, you can drive short distances at this stage, but if you have any reservations at all, or if you have access to another safe driver, please use common sense to not jeopardize the safety for you or others. Ultimately, if you don't feel safe to drive, then don't drive. Please remember, just 3 weeks ago, you had a major operation on your shoulder. It is natural to still have some pain and swelling, and you need to still maintain some discretion and precautions with your activities. Your motion and pain are going to continue to improve over the next several months. Now is not the time to overdo your activities, and please don't do anything stupid which may compromise your recovery. If you have to think twice about whether to do something now, don't do it. Your therapist has been instructed to progress you according to Dr. Badman's protocol and your individual progress. Some patients progress quicker than others. This is completely normal. Do not get discouraged by specific numbers on the therapy protocol. These are simply just general guidelines. The most important thing, again now, is to not do anything excessive. Our team will plan on seeing you back at your regularly scheduled appointment in the next several weeks. At this upcoming visit, another x-ray will be obtained and typically the sling is removed completely. The real Dr. Badman looks forward to seeing you. If you have any questions or concerns at all, please contact our office at your earliest convenience.